5 steps to drop the pain pills and get better sleep. What if I told you that there was a way to do this? Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical in Amarillo, Texas. If this information is not relevant to you, well, share it anyways, because I promise someone you love is suffering from pain and needs some information and some encouragement. Low back pain is the leading cause of disability globally, so the chances are very high that this information could be the information that makes the difference for your loved one specifically. Now, pain is a beast, especially pain that has been sticking around far too long. If it's been around after a certain point of time, it's inappropriate. It needs to go. Not only can pain keep us from being productive and active, but it can also keep us from sleeping, and this actually has a name. The name is the Terrible Triad. That's a bad name, right? The Terrible Triad. This is where pain causes patients to become preoccupied with their pain. They want to tell everybody about it. It's all they think about. And this leads to depression, which then leads to irritability. Depression and irritability often then leads to insomnia and weariness. That leads to more irritability, depression, and pain. Suffering, sleeplessness, and sadness repeating themselves and compounding and building in severity, that leads to a downward spiral, and this is the key characteristic of the Terrible Triad. One problem compounding and leading to more severe other problems down the road. So a lot of people who come in to see us here at Creekstone Integrated Medical are people who are taking too many anti-inflammatories or pain-killing medications on a weekly or daily basis, and they're ready to get off of these medications. Some pain-killing medications, they can be addictive. Some over-the-counter medications can cause stomach problems, ulcers, and even kidney failure. There simply is no good argument for a lifetime of pain medication versus simply getting the right kind of treatments for the issue so that the meds can be ultimately avoided altogether. So let's get to the steps to drop the pills and get better sleep. There's 5 of them here. Number 1, understand chronic pain is bigger than pain that's just been sticking around too long. It's a bigger deal. Number 2, deal with the pain according to evidence-based medical guidelines. Number 3, get moving responsibly. Number 4, get more sleep by practicing good sleep hygiene. And number 5, practice stress reduction techniques. So let's briefly discuss each step so that we can clarify things a little bit. Number 1 was understand chronic pain is bigger than pain that's just been sticking around too long. So patients don't usually realize that pain begins to turn chronic and long-lasting and harder to treat after only 3 months or so. It becomes harder to treat and harder to completely eliminate. Only 3 months, folks. This is unfortunate because a large portion of the patients we see in our clinic have usually tried their family doctor first. Then they have maybe tried physical therapy, and then maybe they've tried a surgeon, or they tried to treat it on their own at home for a long time. And finally, after several months, we have the opportunity to finally take a look. And by that time, the pain can usually be settled in and very, very comfortable, making it harder and harder to ultimately evict from its new comfy home. Chronic pain is thought more and more these days to be a bigger umbrella, and under this umbrella lives things like fibromyalgia, migraines, irritable bowel syndrome, pain, of course, and potentially even autoimmune issues like multiple sclerosis, rheumatoid arthritis, and lupus, things of that nature. So chronic pain is a pretty big deal. The first step to conquering chronic pain is to understand it. So we help our patients do just that right here in our clinic. Number 2, deal with the pain according to evidence-based medical guidelines. Now that our patients understand more about chronic pain, the next step is to start climbing out of that hole. And one step at a time, it can be met head on, and chronic pain can be improved. Many times, Clinics make up their own treatments and guidelines just from their own experience. That's kind of haphazard and not very dependable. But here at Creekstone Integrated Medical, we use national recommendations from the American College of Physicians, the world's largest medical group. And we use Clinical Compass for treatment frequency guidelines. These guidelines are based in the research literature. This way, we know for certain that we are treating our patient's pain in the right way, in the way that evidence-based medicine says to treat it. The American College of Physicians recommends the following for first-line treatments for back pain: spinal manipulative therapy, exercise, massage, low-level laser, acupuncture, yoga, tai chi, cognitive behavioral therapy, and then a few other ones that just don't come to mind right now. But we do the vast majority of these techniques right here at Creekstone, in addition to trigger point injections and other medical services through our clinic's medical provider. Now, number 3, get moving responsibly. Now, think about somebody that you know that has had surgery. Maybe you yourself had surgery. For most surgeries, musculoskeletal surgeries anyways, they have the patients up and moving and walking around the hospital as quickly as possible, sometimes that very same day. So pain science is very, very clear. Sedentary behavior leads to depression, anxiety, changes in the brain, lack of sleep, and even more pain. One of the biggest first steps to dealing with chronic pain is to move and re-engage in your activities of daily living and the things that you love to do, even if it hurts. Patients must be taught to understand that hurt almost never equals harm. Movement is healing, and motion is the lotion for our joints. Move it or lose it. Get back to your activities at a level that is tolerable for you, even if it hurts. If you feel that a movement is harmful, well, it makes sense to either alter that movement or eliminate it altogether and then talk to your care provider. But in general, you gotta get moving, even if it hurts. Hurt rarely equals harm. Number 4, get more sleep by practicing good sleep hygiene. Most patients don't realize that getting a good night's sleep is a big key to treating ongoing pain. In fact, it is simply vital to get over chronic pain. According to the CDC, good sleep hygiene consists of the following: be consistent. Go to bed at the same time each night and get up at the same time each morning, including on the weekends. Make sure your bedroom is quiet, dark, relaxing, and at a comfortable temperature. Remove electronic devices like TVs, computers, and smartphones from the bedroom altogether. Avoid large meals, definitely caffeine, and definitely alcohol before bedtime. And get some exercise. Being physically active during the day can help you fall asleep more easily at night. Another reason to get moving, right? And then prepare your room and set the stage for a good night's sleep, and you're going to be more likely to get that 8 or more hours you need to make a difference in your pain levels. And then number 5, our last step, practice stress reduction techniques. Recall the Terrible Triad: stress, anxiety, depression, sleeplessness, and deeper, more intense pain can all stem or be exacerbated by stress and anxiety. Not all pain can be treated from the outside inward. Many times, in fact, most times, having a component of treatment that approaches chronic pain from a cognitive perspective is the proverbial game changer. Here at Creekstone, we give our patients guidance on this part of the program as well. So these are some ideas to get you started on the path to conquering chronic pain once and for all. But make no mistake, it is a journey, and it cannot be handled in just a visit or two or through maybe an exercise you do once every few days when you remember to do it. Treating chronic pain must be done with the frame of mind in place and with the patient and provider acting as a team, each doing their parts. If you're from the Texas Panhandle, or you're going to be passing through and you'd like to be seen by us, you can call us at 806-355-3000 to get on our schedule. We'd be happy to help you out. Like I mentioned, from the top, if you're watching on YouTube or Facebook, subscribe, won't you? Like, comment, share, do all of the things. That's how we do it in 2022. That's how we continue to help people the right way by the right providers. Again, I'm Dr. Jeff Williams with Creekstone Integrated Medical. Until next week, stay safe and smart, and we'll see you then.